Oh man, I always want to say something funny when it comes on. They disappear and then they come back. I have this hilarious bit where I'm like, and so then that was the whole secret to life. And then you get it? But that
You've done
wasn't.
that with me before because
I
I
know, but I want like something better than that. My daughter Mackie will say, I don't remember what she said. I used to have a funny one where people would come back on, I'd say, and then I said, wrecked him, darn near killed him.
or I don't know, this is less gross, but what about and that is why Hitler is actually a hero or
Oh
something like
gosh.
Christian. That's where my mind
Okay.
goes.
Okay. Oh, you could get in a lot of trouble for that one. I mean, not that one in particular, but I mean, like that. Mine now might you just unlocked a whole new level for me where it's like whatever the bad thing is. And then I said, is Helen Keller Eve really a hero? I mean, like that would be so bad. Okay, I gotta edit that.
But it would be funny
Oh,
to me. Well, that's always the funniest stand-up comedians, right? Is
yeah.
they just push it enough that you're like, you did not just say that, but it's so funny because they
Oh,
did, but you're not sure if it's okay for you to laugh. Those are the funniest ones
they are. So am I
because they
leaving
don't
that
take
in
it too
there?
seriously.
Am I leaving that in there?
I'll leave it up to you, to your discretion.
Well, I
I
mean,
don't know.
I did make the hilarious comment that Love ADHD just turned legal. This is episode 21,
Did
and you didn't laugh.
because I was sending a text message to someone else about Adderall because there's an
Okay,
Adderall shortage.
that's right. And
Because I was
that one's
multitasking. I was like, funny, Tony. And you're like, you don't think it's that funny. I'm like,
yeah.
huh?
And then
Yeah,
I'm
that's funny. Then I'm
and
like,
then I'm
sorry.
no, then I'm navigating rejection sensitivity. Well,
I
I will.
know.
What's crazy though is that the medication shortage is real. And when I can't remember, I take Ritalin, generic Ritalin, methylphenidate. But even then, my doctor was telling me that there was this shortage. And then, and I went through two or three. This okay. This is a funny story because we're not even. This isn't the topic, but this is the show. So then I try a couple other things, different versions of. I did. He put me on an Adderall. He put me on an extended release, an immediate release, and Ritalin works for me. And so then at one point I just was saying, okay, hey, can I try this, maybe the brand name of Ritalin or Ritalin, not methylphenidate? And then I got a response back from my doctor's office that said, hey, we need to talk. You should not be rifling through different medications. And I got really offended and I said, I'm not. You stopped giving me my medication. I'm trying to find the right medication. And then he was nice.
Right.
He's like, oh, okay. Okay, that makes sense. And I was grateful for that because I was like ready to go to blows over my Ritalin. I also had another two quick things on that. One is that he found it in the formulary for it also treats narcolepsy. And so what was really interesting, I shouldn't speak this because now there'll be a national shortage of my beloved methylphenidate, but then he was basically able to find it on the formulary for narcolepsy, I think. So not that I had to be prescribed narcolepsy, but the medication is available, but I don't know how doctors work. But he had to look at a different bucket of diagnoses. I don't know, but it's the same medication for me. And then one other funny story that comes with that is I take the 10 milligram immediate quick release, and but I take more than 10. I take a few more than that. I feel like I don't want to talk about it, how many, but let's just pretend that it's 7 a day. So, but they're in chunks of 30, 20, and 20. So this is relevant. So then 7 a day, 30 days in a month. I'm a therapist, but I can do that math. I think 210 pills. And this was again back early on where he at one point he looked and he said, man, that's a lot of pills. And I said, well, if he just gave me 235s and it wouldn't seem like that big of a deal, would it? It's like it's just math at that point. Or give me 320s and a 10. Then we just knocked the number of pills down. If the number
No
of
biggie.
pills, I was like, if number of pills is what's bothering you, then we can fix that. I don't care. Like I just the medication helps me. So anyway, wrecked him, darn near killed him. That's what I said.
I'm not saying the Hitler thing. Wait, I have a question real quick
Okay,
though. So we're
okay.
on episode 21, which means
Yeah.
we're legal, which is very exciting. Which direction are we taking this episode? I am so good with either. I am so
Oh,
good with either. Are we
what's the other
talking about
direction?
meds? Well, we could talk about
Oh,
meds after my weekend, or are we talking about this really
oh.
cool article we read?
Why
I'm
don't we let's
I'm
tease the article for next time then? So we got an amazing article that is
okay.
fight, flight, freeze, or fib.
Okay, but are you sure that's what you want to do? I just was saying that because of the comment you made before we went on air. We could talk about meds, I thought is what
Oh,
you were saying.
oh
But
yeah.
I'm
I was just
happy to
saying it.
talk about the article.
Well, I was saying it for like a warm up, and then we get to the main thing. But
Oh,
I
that's
forget that
great.
we only do 30 minutes, which is really good. I think people appreciate that. So why don't we just do a hey, what's going
Vibe
on,
about
Julie?
meds for a little
Yeah,
bit.
let's do.
Okay.
And we could tell because I could tell you other stories. We could tell anecdotal stories, and we'll leave all this in because what you talked about before we went on is
Mhm.
real. And I think that we could talk honestly. Now, Tony lowers his
Yes.
tone into his therapist mode. I'll make sure and put some ambient music on in the background and say, Julie, tell me more about that. Because I think a lot of people
It's
have these
really
med
fun.
questions.
Yeah,
Okay.
it's really fun to do your own personal therapy live for other people to hear what a mess you are. That's what I love about this show.
You're not a mess. You're just
No,
being and
it's
doing.
good. You know what? I
Yeah.
am just being and doing. And what's actually neat is being in a place where really I don't, this actually helps me not feel alone because the thing
Yeah.
is, sure, we're willing to talk about this, but it's not like we're the only ones. It's
Oh, for
just,
sure. Yeah.
there's so many people that struggle with these type of things. So I was just telling Tony, so, okay, just in my brain, we're going to talk about meds today,
Let's do
right?
it. Yeah.
I'm not going to worry about this article right now. It's
No,
a really
don't.
good one though. I am
Yeah, we'll
excited to
get
talk
to it.
about that though.
Okay.
So this weekend, I was on an antidepressant, right? I used to be, if people followed me on ICU and know some of my background, when I started speaking in public, if you've read my book, ICU, you might know that in my early 20s, I had kind of my first mental breakdown, dealt with some childhood issues, but I started doing some EMDR, working through some PTSD from kid stuff, the whole just confusion of what am I dealing with here? I don't want to be like what I saw growing up, just a compilation of a lot of things. But as a bubbly, outgoing, driven girl, this was really hard to make sense of all of it. So I was treated for anxiety and depression, is what I'm trying to get to.
Hmm.
But I was always trying to get off those meds and out of therapy because that was really scary to me to be, because I was the teenager that was like, no, I've watched a parent be depressed my whole life and how that's impacted our family. So I will force myself not to become depressed,
Yeah.
right? In fact, I did a video for our church called I told myself I would never become depressed. Anyways, that was my thesis, my mantra for life. So then to struggle myself was really hard. So then I turned 27. I come to this place of acceptance. I've got little kids with big blue Disney eyes like me, and I'm just like,
Mm,
it doesn't matter.
yeah.
And I'm on meds for the rest of my life. Like you're gonna have to take them from like my cold, dead, clutching hands. I am
Yeah.
completely reliant on medication, and I'm at peace with that because guess what? It helps me feel normal, be an awesome mom. I can have bad days and realize that tomorrow could be better. It's a big deal. So then I've been on the same antidepressant for 7 years. It's
Okay.
called Effexor. And the thing about Effexor is it really messes with your sleep.
Mm,
A lot of antidepressants have side effects. That's it. And so if you take Effexor, at least for me and what my doctors described to me, if I don't take a paired sleep medication with it, then
oh,
I
okay.
wake up like every 15 minutes.
Wow.
I don't sleep at all. And it's very instant. If I don't take it that night, it will be a problem that night. It's not like one that builds up
Okay.
over time, like
Yeah.
the antidepressant. So for 7 years, I've been taking an antidepressant and then a medication called trazodone, which is, you may have heard of, a
Oh,
very
I have heard of
old
that.
antidepressant, very
Yeah,
old one that
yeah.
they realized is actually better for sleep than treating
Interesting.
anxiety and depression. So I've taken this forever. Well, now a year ago, as listeners know, and as you know, I get an ADHD diagnosis.
Hmm.
And that really falls in line with my experiences, both as a kid, as an adult. So I've been treated for anxiety and depression, which can be symptoms of ADHD, absolutely. But then I'm starting to wonder, okay, so is the root cause of this actually ADHD? And
Right.
we've kind of been putting a Band-Aid on what the real root issue is, which is ADHD. And I've never taken medication or worked on that specifically. It's always
Yeah.
been to treat these symptoms. So understandably, I go to my doctor and I'm like, hey, they have me try Adderall. It's amazing. It feels like I'm putting on prescription glasses. All the amazing stories you hear, it's real for me. I say, hey, so now I'm taking this antidepressant I've been on for 7 years. I'm taking a sleep medication and now I'm taking Adderall. Feels like a whole lot of drugs I'm putting
Mm,
in my body. And I just am not convinced I need all of that. And I am absolutely a proponent that if medication helps, use it. Great. But I just worry that we're layering all these meds and I don't know what's what. You with me
yeah.
so far?
Oh, yeah, so
And
much. And I
I'd
want
like
you to
to
know, Julia, this is
simplify.
where
Yeah.
I am doing a nice job. Let me one validation of staying so present. I've even toned down some of the jokes while you're saying this because I think this is so real. The therapist in me gets to deal with this often. I have a lot of thoughts, but
Yeah.
I'll get to them after because I appreciate this so much.
And I do want to hear them. And
Go
I
on.
haven't
So,
been to therapy in a while, so maybe this is good for
okay.
me. I actually just called and left a message this morning. I was like, I think I need to get back in for an appointment. It's been a little bit. I usually go in like every month or so. It's
Yeah,
just good
check
for
in.
all of us. So my doctor's like, yeah, good idea. Let's wean you off your Effexor, the antidepressant.
Uh-huh.
And I've actually found this other medication to be really good for this antidepressant. It seems like my patients that have ADHD, for whatever reason, it's been really effective for them, and they
Mhm.
don't even need Adderall anymore. They just take this. It's like an antidepressant for ADHD. And I was like,
Interesting.
huh, okay. First of all, Effexor is like the worst antidepressant to wean off of. If you look it up, it is
Oh,
like absolute hell weaning off it. It's like
uh-huh.
one of the worst. Luckily, it was really effective for me for a long time. I didn't feel like it was working as well this last year, but also life's been crazy, so it's been hard for me to know. But I
Yeah.
just was real when I went into my doctor about layering meds. I also felt like I don't even know that my medication's helping. The Adderall is for sure helping. I noticed that difference, but in general, I'm really, really just struggling with
Hmm.
energy, motivation, everything. So maybe I just have too many drugs in my body. I don't know. What can we do to simplify here? So he's like, let's wean you off Effexor. We did it really slowly because he's his words were, it's going to be like PMS times 10. I was like,
Oh,
awesome. Awesome. Maybe that's why I broke up with someone during that point. Just kidding.
okay.
Probably not. But I did warn them. I was like, just so you know, a guy I was dating at the time, that was a fun conversation. I was like, things might be bad here for a minute. So anyways, so I get off the Effexor. I'm crying daily. That's what
Mm,
I'm just super emotional. But we got through and I expected that. So it was okay,
okay.
doctor. We checked in every little bit. How you doing? You doing okay? And as I'm getting off the Effexor, I'm getting on the Prestique, which is the new antidepressant that's supposed to be good for ADHD.
But I'm
Okay,
looking up
so
Prestige while you're talking. I just want you to know.
yeah, so
Yeah.
it's Priste.
QUE, right? Isn't that it? Prestige? No,
I think it's IQ.
PRISTIQ. Yeah.
It
Okay.
doesn't follow the QU rule. It's too
Right,
good for
right.
that.
Okay.
Executive functioning is that's for boring people. Okay,
Right.
so Prestique. So I'm on Prestique now, and I'm feeling like, hey, I'm feeling pretty level, pretty good. And they said some people don't even need their Adderall. And I'm like, you know what? I don't even know if I notice as distinct of a difference when I take my Adderall like during the day. So I think maybe I just need the Prestique. And so
Okay.
they're like, yeah, you can try not taking it. So this last Friday and Saturday, this is the climax of the story. This last
Oh,
Friday and Saturday, I'm like out of Adderall, and I'm like, I don't even think I need it. So I'm not going to refill it. I'm just taking Prestique now. I have the worst day ever Friday and
oh,
Saturday. I mean, like both days I'm crying. By the end of the day, I'm just like, life is so hard. I'm so overwhelmed. I feel so alone. I feel depressed. Things are just feeling hard. And I mean, I need to be with people. I was like, who can I call? I just need to talk. And I'm like trying to be a parent at the same time, going in the closet, like having just falling apart. Now, having said all that, all the reasons I'm crying are valid. There is a lot
okay.
going on in life right now, okay? But it's just amplified to this level of I can't handle my shiz, right?
Mm,
And then I just later in that day, I have this feeling where I'm like, you haven't been taking your Adderall. I wonder, so I did have some quick release left from before. I
okay.
take slow release now because I like it better,
Yeah.
but I have some left that I almost got rid of. And I was like, I am going to try to take one and just see how that affects my day. So Sunday I take it. I kid you not, like 30 minutes in, I'm like, today is the best day ever. The sun is shining.
Oh,
Man, I just love being a mom. I'm just like doing my hair. Ugh, I want to look pretty today for church. Like just for me, it sounds
yeah.
nice. Life's good. Oh my gosh, I want to Marco Polo all these people. I just love everyone in the world.
Oh,
And
there
all
you
of a sudden
go.
I'm like, oh my gosh. So I see my brother-in-law later that day who I talked to the day before and been, dude, I'm just feeling alone. Life's doing hard. He's like, hey, you seem a little brighter today. And I just looked at him bashfully and I'm like, I took my Adderall. And he's like,
Okay.
dude, just take it. I'm like, still after all these years, Tony, you have seen me, like,
Yeah.
you know me. Our
Yeah.
first episode together, you wanted to do specifically as Julie, you're so good to talk about medication without shame. Still after all these years, though, I'm still
Yeah.
like, but can I do it without? And why do I need it?
Well, it's so funny too, Julie. Like so many thoughts that I weren't even thinking before, and I know. Well, I apologize if it looked like I was being distracted, but man, I Prestique and I just started Googling, which I was about
Yeah,
to even say I know I shouldn't Doctor Google, but we do. Their therapist in me says the acceptance of we do, but it's
yeah,
interesting like how confusing it could be because I found a couple of threads that said that yeah, it's like on some scale, it was by some people's reviews, 7 out of 10 for that people were giving it for reviews of treating off label Pristiq off label for ADHD, but then other people are saying, wait, it's a is it SNRI? So it's about norepinephrine or something. So then they were talking about, no, it could be serotonin syndrome. And then somebody's like, but my doctor prescribed it for me and it works amazing. And, and then somebody else saying they got prescribed Adderall and Pristiq and it's the greatest thing ever. And then somebody saying, what, those two together? It's so confusing. And I think that's the part that's really interesting with, so it really is the figure out what works for you. And then it's hard to not listen to everybody else. But I think to your point more specifically, medication changed my whole life. And I noticed, like, we were driving back from Utah from a wedding to Arizona yesterday. And one of the honest to goodness benefits of having a stimulant is you aren't having to chug energy drinks or 5-hour energies in a car. Like, you really can drive for days and it's the greatest drive ever. And the music's amazing. But I find that I put my medications in a little pill bag that I've always used in my ultra running to keep salt tablets and things like that. So I feel like a druggie. I'm taking my little pills out and I don't want my family to see them. Like I'm doing something bad, and, which is really funny. And so yesterday my goal was just it's like I'm taking my medication because normally I don't announce to the world I am medicating now. But so I like to think that I'm over the shame too. But I'm sitting there and I'm just saying, I'm sitting there like, I feel like I'm, getting my mortar and pestle and crushing it up and I'm gonna like inject it between my toes or whatever, when really it's because at
like,
one point, yeah,
really sniff it out of the crack here.
Oh,
Or
I
something.
see.
So
Oh,
I
I
hear.
did not know, Julie. But I was looking for. I was like, anybody got a straw? Can I get ice? And I'm cutting it up with my credit card. See, I've seen enough movies.
I dated a former meth addict.
Oh gosh. Okay.
I've learned some things. That's a different story.
I
Different story.
bet. I
That's how I
bet.
found
Yeah.
I had ADHD.
Oh.
Okay, different story. We got to talk about crack and ADHD meds
Okay, for
in a
another
minute.
day,
Okay,
right?
go.
Okay. But I just want to say that it really is. There's enough of the your mileage may vary, and I'll tell you why. Because a friend of mine that I think I actually told him, I asked him if he would want to come on here and all my podcasts at some point because he's getting his PhD in epigenetics, and we were talking and I just said, what have you been up to lately? And he was telling me that he had guest lectured on gene therapy. And I said, okay, I'll take my blue gene comments aside and then tell me what that really is. What's genetic therapy? And he said, well, take your ADHD, for example. And he said, okay, so your DNA is such that it's not producing dopamine. And he said, the future of, and this is where this is funny, because I almost was like, no, don't take my stimulant away. But he was saying, imagine that then you can go in there and you can have a vaccination that will then deliver you the genetic material to then repair your DNA so that then you produce the dopamine. And it was funny because I was like, that sounds amazing. But I thought, but will I not get that little bump of hope? And I just thought, wow, that's really sad. Because is that the part of me that's like, but without that, I don't know if I'm doing well. But then I have also noticed that since our move, like this morning was one of those days where I got sleep last night, which I normally don't. We actually bought a new one of those beds that moves up and down on the both sides. And I found that I monitor my sleep. And if I sit with it up, I don't snore apparently. And then my quality of sleep is higher. And then I got up this morning and I exercised and I ate a breakfast and I was hydrated and I came into my office and it was probably the first time that I can remember where I had not taken my medication yet. Like normally I know I'm ready to as soon as I can. And then so I did before we came on, which is really funny. Julian, I've already had a client this morning. And so then part of me was like, okay, but is it a thing where if I really am getting rest, exercise, hydration, at least I'm not saying that take me 5 more hours into the client day and then I'll have that scatter and I'll say, where'd my genius go? So I'm not trying to say that's the ticket to then no longer need medication, but it was really fascinating because I come off of this day where felt like I need to hide my pills. And then today I did a little bit of that. What if I did sleep, exercise, hydrate, and not work a whole bunch? Would I then need it? And if I just embraced it? But I already embraced it. I guess that's the wrong word, but you know what I'm saying?
Well, and my whole thing, yeah, yes, just medication in general. I remember at different points in my journey before I knew the ADHD, where I would say to I'd be bawling on the phone to my sister. I'm in between, I'm not on an antidepressant, and I'm like trying to do it without. And I'm like, but here's the thing, if I get the perfect amount of sleep,
Yeah.
and I exercise hard, and I say all my affirmations, and I read these things, I take spiritual time, and I do all that, I think I can, and I don't listen to anything hard, and I don't hear about hard things in the world, and I'm listening to things, then it's like I can survive the day. And I remember her just saying to me, Julie, that is a lot to
Yeah.
keep up with
That's a good point.
24/7. Because I was like, then I'm like not quite having a mental breakdown. I'm like able to
It's a
forget
good
it.
point,
I'm
Julie.
able to,
Yeah.
and she just was like, whoa, if I expected all of that perfection
Yeah.
every day of my life, whoa. And that was interesting to me. And she's, can you give yourself a little grace? No one should have to live that perfect
Perfect.
keep from
Yeah.
having a panic attack.
She's
And I'm not
wise.
saying
That
that's
was
the
good.
answer for everyone. And
No, but
maybe that's
that's,
also in part where I was at that
yeah.
time. Like I needed the help, but I just think there's got to be a place for yes to all of that. And also that's really exhausting to have to be that perfect all the
Yeah.
time.
Well, and I think the part where when people are recognizing these things in their life, at that point, it's 4 kids and a mortgage and debt and a job and a marriage and all those things that are at play. And so you're right, because I like to, when I'm telling people about epigenetics, for example, and you have a genetic predisposition for things. Thank you, ancestors. But then my joke is always, but then if you happen to find yourself being raised by hippie parents on the beach who have won the lottery, and then you have a bunch of cool friends and you surf all day, and it turns out you like math, then your genetics are not going to express themselves in a way of maybe as much anxiety or depression. And but then look at all
Yes.
those. That's, I call that the crapshoot theory as well. That's not a scientific term, but I've made that one up. And it's the same thing where I find people that find themselves in relationships. My wife and I got married at 20 and 19 to each other, and then it's 30 something years later, and there was 20-25 year run there where it seemed like this is pretty cool, when the kids hadn't really hit a certain age yet. But it was because we happened to be aligned in so many areas that we had no idea. So then I do feel like that's the thing where, yeah, in a perfect world, but then I will say, honest
Yes.
to goodness, though, I'm not just trying to tell everybody listening that, but aren't you glad that there's struggle? But really, that is where the growth comes once you embrace the discomfort and have the right tools. And this is kind of a fun episode today, because, and I didn't even
It is
tell you
kind of
about, like,
fun. And it's
right?
something
Where,
I think about. I literally think
yeah,
about this daily. Like I have this struggle in my brain daily because I see the things about the supplements and then I see the new technology for this for ADHD and I see all the stuff and I just think, wow. And then I go 2 days without my Adderall and I'm like, life is impossible. I can't do anything. I can't. And in that moment, I'm like, I would do anything to feel better right now. Like
yeah,
and it's not to feel better. Like I want to go on a joyride and have a high. It's I want to be able to sit down and play with my kids and not be like
yeah,
feeling, I don't know how to, I can't keep doing this
yeah.
forever. Do you know what I mean?
Oh, I
That
was gonna
kind of
say, or like for
panic
me
feeling
at
of
this
like,
point,
life
well,
feels so
yeah.
hard.
And at this point, it's like I
Yeah.
want to live up to the measure of my creation. I want to be able to do the things that I feel like I'm here on earth to do, because that gives me a great sense of purpose.
Yeah.
And that purpose-driven life is significant. Before we run out of time, too, when you were telling your story, and I so appreciate it, the part where it takes me back is I was ready to start. And not that antidepressants have been an amazing thing for so many of my clients, people within my family, but it was wild because I had never considered myself depressed, and I was ready to start looking into antidepressants because I realized at that time for me, I think I mentioned before, I had this practice that I needed. I basically did a whole career shift, and it took longer than I thought. And it was like I was banking on this new career change, and I'm getting close to the point where I could it's now or never. And there was that like imposter syndrome. And what if I can't do it? And then I might at that point then, and my website wasn't completed. I think I'd maybe fallen through one book deal. And then I had bought my podcast equipment and sat on it for 2 years. And so I was sitting there thinking, what's wrong with me? And then it was like, I worry at times that had I gone down the antidepressant route rather than gotten the ADHD diagnosis, I don't know, not saying that that would have been bad, but I worry that it would have been more of just like a helped me get through this, what's wrong with me.
Band-Aid.
But yeah, Band-Aid, but the ADHD medication was like, it was oh, this is it. And then from that point, it has been a game changer over the last 7-8 years for me personally. So that's the part where when I hear that, and then as an acceptance and commitment therapist, so much of the feeling down is because I don't know who I am. I don't know what my values are. When I try to express them, those around me tell me, no, you shouldn't care about that. You shouldn't feel that way. Then that whole concept I like talking about where I think we have the wrong tools in general being mass produced of this starting with the what's wrong with me, I'm broken, my stinking thinking, then just change your thought. No, just choose today to be happy, which is a great thing when it works. But it's really like that. Oh, this is who I am, and this is how I feel, and these are my thoughts. Check those out, and now take action on things that matter. But boy, you can now we know the more we talk about rejection sensitivity, and then just feeling overwhelmed, and then not having that right kind of difficult because we're trying to do the kind of difficult that we think we're supposed to. And you can see where I think that would make sense that would lead to feelings of depression, and then looking to others to say, what do you think? Or how should I act? And then you got other people that are, whether it's immature, and I'm handing that power over to somebody that's, I don't think you should do that because it threatens them. Because if you all of a sudden succeed, then all of a sudden they realize, oh, wait, I could have done the same thing. Well, then I need, when that stuff's happening subconsciously anyway. So
Right.
sometimes I worry that the ADHD diagnosis and brain and all these things are not getting an opportunity to even thrive because of the what's wrong with me and being in relationships with immature people and afraid of rejection and all those sort of things. So maybe some of that's, if I come back to the, maybe that's like what's underneath where we still both sometimes want to be like, I don't know, should I take this medication? Like almost like I need somebody else to tell me it's okay. It is okay to me first. I give you permission, Julie, and to the world, as long as they need it and they're not,
It is
it's
okay.
just not trying to study and or sell it to kids. Yeah, there we go. Those are bad, right?
That's another episode. Yeah.
Well, maybe we'll end with this. Ritalin is methylphenidate. It's funny because I will still have a client or two come in that don't know my journey. And first of all, how dare they not listen to all my podcasts of
How
everything,
dare they?
right?
Absolutely.
Somebody will say, it's just meth. It's the same thing as meth. And I have Googled this and I've watched a YouTube video on it. And I'm not smart enough in the sciences to know that wherever the compound is, that methylphenidate and methamphetamine, they're from, maybe it's like the same family, but then one of the cousins goes bad and he joins like a biker gang. No offense to biker gangs, but I'm trying to come up with a funny story on the fly here. But like they have maybe the same grandpa, but then the kids are all different. Maybe I'll talk to Chat GPT, and the next time I'll come up with a, hey, remember last time when I was saying this? Then I'll have a fun way to put that. Because what we're saying is Love ADHD does not endorse the use of methamphetamines.
I have a friend that had a history of being hard into drugs, and he actually was surprised now, 20 years later.
So, hey, everybody, we're back. Little did you know that Julie and I had an amazing, spirited conversation where we decided that we shared some information that these will be the hidden files. But so, hey, kids, make sure you don't do illegal drugs and you just get your drugs from your doctor and from a pharmacy, and remember who you are and what you stand for, and love your mom and dad. And Julie, take it away for the Love ADHD. It was amazing. Maybe this will be someday the bonus things. If you want to hear Julie and my conversation, that'll be $1,000. Yeah, exactly.
Money.
Yeah, exactly. Okay. That's right. Get paid. Okay.
Dear Aaron.
Is that AARON or ERIN?
AARON. Thank you for clarifying.
Aaron. Okay.
Dear Aaron. Medication is amazing. If it works for you to help you be more cohesive with me and use your superpowers, dude, do it. Don't feel shame about it. Just work with your doctor. Aren't we so grateful you live in a day and age where you have that and where it can unleash your superpowers? Be responsible, work with your doctor on it, and don't feel guilty and just feel grateful that you have it. And if other people make you feel bad, that's on them. That's a them issue. And just go kill it in life and don't overthink the medication thing. Love ADHD.
Julie, that was perfect. And I'm a big fan of Aaron. I'm a big fan of you. And now I feel like even though I know that we're up against the wire here, so to speak, I have to end. If we're talking about medication, and I know we've talked about this before, but listen to this, like with kids stuff. And I talk about this whenever I get a chance. Here we go. Okay, so I love the Love ADHD because for real, and I like that you addressed it, even whether it's a young person. So this is from ADHD 2.0. They say about medication, and I know we've talked about this off and on, but I think for this episode, addiction and abuse. Spoiler alert: taking a stimulant or stimulant-like drug early in life helps prevent, not promote addiction later on. Since 80% of addictions get started between the ages of 13 and 23, and since people with ADHD are far more prone to develop an addiction than the general population, and since taking stimulant medication reduces the risk of addiction later on, it makes a lot of sense to start a child on stimulant medication before age 13. Addiction and abuse are understandably some of the main concerns cited by those reluctant to take an ADHD drug, and the concerns are valid. In fact, ADHD drugs are listed among the top drugs abused by high school and college students. It's important to note, though, that ADHD stimulant drugs are mainly used inappropriately by those not even diagnosed with ADHD. These neurotypical abusers use them to stay up or study or mix them with other drugs like alcohol, marijuana to intensify the high. It is less common for those who have ADHD to purposely take far too much of a stimulant medication. Long-term studies found that those with ADHD who are successfully treated with stimulants become addicted to substances far less than the general population, and certainly less than the population who have ADHD and do not take stimulants. And then it's like so crazy when you hear this, right? And then they say on the flip side, teens who have ADHD and are not treated are 5 to 10 times more likely to become addicted to substances. And it's a myth that people come to psychiatrists to get the highest dose and greatest number of pills. Although, see my story earlier, if they only give you little 10 milligram pills, then you're taking a lot of them. Indeed, one of the biggest problems we encounter is that patients do not take the total prescribed dosage for the month, which goes into you not wanting to take yours, right? And me too. The tough part is keeping them on the medicine, not making sure they aren't angling for an overabundance of extra strength medication. That being said, when people go off the stimulant medication, they can experience slight symptoms of withdrawal. This happens every evening, and the symptoms can be so mild as to be missed, or can lead to increasing tiredness, anxiety, aggression, or a variety of other presentations, which leads us to a discussion of common side effects. So, I mean, that's the part that still to this day blows my mind. If you're on the fence about it, and especially with your kids, Sydney, who co-hosts a bunch of my stuff with me, is now on medication. And it's funny because she's even said that she lived in this world where her room was always messy. And one of the first things she did when she got on a stimulant medication was clean her room, which then she realized that led to her, she didn't realize how much the emotional clutter was tied together with that. And it's so wild to think what a stimulant medication can do to bring that focus. So thank you for your vulnerability today, Julie.
You're welcome. Thanks for giving me the space.
Yeah,
It's good.
I feel
We'll have to have some follow-ups about medication because it's
let's
like
do it.
I think it's good, and I also feel bad that we don't always have a clear answer, and maybe that's just because there isn't a clear answer of what any one person should do.
And I like that you're saying let's follow up on this. I moved. I have to change insurance. I know that's one of the most frustrating things for people in general is, and so I'm about to see a new provider who doesn't know that we host a podcast. I've been doing this forever, and so I am very curious to see what that experience will even be like. And I'll be honest with our audience, right? Will it be a shame-based experience? Will it be somebody that says, "Hey, whatever you need"? I want to know, because my doctor, who I've been with for a while, even though I made these jokes or not jokes, but tell the stories earlier of him talking about the number of medications and when there was that initial shortage, and he was the one trying to help me find a new one. Whenever he would sit and listen though and understand, he would roll back those remarks. But I know that also, I think I'm a therapist, I'm in my 50s, and I give a little pushback because I'm a grumpy old man now. But if I was in my 20s and somebody said that, I think I could have really felt like, oh, I'm not going back. I'm not getting more. So anyway. Yeah. All right, Julie. What a joy, as always.
Yes.
Yeah, same.
Thank you. And next time we're going to tackle that really fascinating article, because I haven't been
that'll always be like one that we never quite get to. Maybe that'd be fun too. Okay.
That article, it's like what do they call that? The goblet they're trying to find in the Holy Grail. Yeah. It's like Beyonce, it's there, but you can never see her. You never know where she is, but she's there.
I did not know that reference, but I think I bet that one resonates with all the kids. That shows that I am
I just made it up.
Man. Oh, it was good.
I just made it up right now.
Let's start.
I feel like it was good.
Okay, Julie. Okay. Have a wonderful day.